In May 2004, Gordon was having lots of trouble swallowing and eating, and in June we went to the doctor and been sent to the hospital for barrier meals, CT scans, gastroscopies, you name it, we had it. He was scheduled for an operation on the 3rd of August, and when they opened him up they found that he had cancer in his liver as well as the esophagus, so they just closed him up and sent him home and said that there was nothing they could do for him apart from trying chemo or radiotherapy.
I found that I had mantle cell lymphoma, and I was informed that I had to have chemo or die.
Well, it was a natural thing that my doctor automatically put me through, and he said, your PSA's high, better go and have a check. Went to this urologist. He slapped me into biopsy, nasty blood all over the place and all that stuff. A week later he said, you got cancer, it's Gleason 6, serious, you better do something about it. I said, yeah, you're right, let's do something, hurry. And he said, well, what do you want, cut, burn or poison? He didn't say those words. But I said, I want to use natural methods, and he pointed the bone at me. He said, you'll feel good, but it won't change anything, won't make any difference. I'm still standing.
Earlier on in January, Dad found a couple of lumps here and there, weren't sure what they were, so we took him to a doctor and we found out it was a lymphoma at his 2nd stage of lymphoma. So it was quite serious.
Gordon lost a lot of weight. He lost 30 kilos in about 30 days, which was fairly scary.
I was lucky I had it to spare. What was the treatment I received? Was chemotherapy over a period of 2 months. And the chemo, whilst I was having it, the reaction was not good. Quite often sick, and it just seemed to be a long time to. You just start to feel better, and then you get the next lot of chemo, and you've got to go through the whole thing again, and it's really depressing.
Then we decided, well, appointment with oncology, and she said we could have chemo. An appointment with the surgeon said that chemo was out and that we must have an operation. So then we went for the operation because then we could have follow-up chemo. When the operation failed, we then went off thinking, where do we go from here? Chemo's not going to work.
So what happened is after Dad was diagnosed, he took the initial thing, of course, was to go to a specialist, an oncologist. Dad commenced some chemotherapy, but we knew chemotherapy, I believe, is a short-term solution. We were really looking for a long-term, sustainable solution, and we didn't feel chemotherapy would have given us that. At the same time, that's when we met Paul, and we started on the nutrition. And then after Dad started to feel better, we made the decision to stop the chemo
completely.
So we only took chemotherapy for 2 months, and we've not had to take it since.
How did I get in contact with Paul Rayner? It was through my grandson, who was very unhappy about me having chemotherapy. He said that it'd kill you, and I should look to alternative medicine. And I just thought, well, what does he know about this? The doctor tells me that I'm to have chemo, and I decided to have chemo. My grandson was unhappy, and so was my daughter, and between them they found Paul Rayner.
We found out about Paul through a friend who knew Paul, and we made an appointment. We only had to wait about a week to get in to see him, and he explained his program to us, and so we went 100% with Paul's program.
We did not have any treatment by doctors. They tried the psych on me, didn't work, and no treatment at all. So he just went straight into the system, and I was told what to do, and I did what I was told.
I contacted Paul by telephone when he was in Perth, and he just, in Paul's way, he just says, well, what can I do for you? And I said, well, I'm looking for someone to help me with cancer. And he said, you can stop looking.
It wasn't, we might be able to cure you, we can cure.
When he was in Perth, he said, get yourself a hands-free phone, get your family around you. He said, because I'm a very busy man, I don't have time to talk to everybody singly. So I did get a hands-free phone, and my daughter, wife and grandson were there to take Paul's call when it came through. He spoke to each of us, told us what was expected, and he said that there would be a seminar on the weekend. Could we attend? I said yes, I would attend.
Yes, we've had a few one-on-one sessions with Paul. Often Paul just called to say, hi, how are you? Or maybe if Dad was not feeling well and we've rang Paul for some advice, 2 days later he'd ring back saying, just following up to see how you're doing. It's been great. We know he's busy, so even a phone call, he still finds the time to say hi. How's your dad doing? I heard he wasn't well. What's happening?
Had a lot of help from Paul. He was sort of embraced me completely. Phone calls, many meetings. The amount of data that was fed to me in printed form was amazing. The program prepared told me just what to do, what to take, how to approach my life, what to do with food, what acid was, what alkaline was, a lot of stuff, and it was just the turning point.
I think the main way that Paul's program helped us was the fact that he had a set data to follow, set diet, set program, set everything to follow.
The system manual, was it helpful? Yes, very helpful. In fact, it sort of explained what you were. It wasn't just alternative medicine in such, because when you talk about juice and you talk about the minerals, and that's just, it didn't say how they could fix you, but in the manual there was, it explained what each tablet was for, and we found them very helpful.
The other manuals are very, very informative and a really, really good reading, and it just, because you have a lot of questions about the medications and what things are or what things are not, and in your own time it's really good just to not just what Paul's saying, and just to read up about what he's saying. Often, sometimes you need to read things 2 or 3 times before they make sense. So the manual is just something there in your own time, pick up and read, rather than try to remember everything that Paul Rayner said,
The first 21 days of the program were pretty tough. The first week especially, because we didn't know how we're going to go with all these vegetables and all the juice. There's only so many ways you can have vegetables. And we thought, how are we going to get over this? It's going to be extremely boring, but going through a lot of little books and cookbooks and things, we managed to do it. And the first 21 days is hard, but once you get over that, you laugh at it.
I am 81, going on 82. When I was sick, I thought I was 180, but now I reckon I'm around about 70, and I feel very well indeed.
So Dad says he feels a lot better than he was 6 months ago. He's a very different man 6 or 7 months ago. Yeah, so you're going to have your good days, and naturally you have your bad days. I think that's going to be part of it. But overall, we've definitely a huge improvement and a big reduction in the lymphoma, a huge reduction in Dad's lymphoma. It's actually almost gone.
Now that Gordon's well again, we've been to his normal doctor, who originally said that we were feeding the body but we weren't treating his cancers, and unless we had chemo, then he would not survive. He is still only treating us for normal things, and he is now looking for Gordon's diabetes that he had before he got sick, which he has no longer got. And our other doctor that we found that helped us in our fight for Gordon's life virtually is very supportive still in all avenues, and he is now supporting Paul Rayner's program 100% as well.
Sitting on top of the world, you might say, because my PSA is 0.2, 4 is normal, above 4 is getting dangerous. Mine was 49.7. That was nasty. So all the blood tests, and I have them, every couple of months. Things are showing are really excellent, and there's no trace of cancer. And my blood pathologist also, she runs it through and scan on the screen. Can't find cancer in the blood, and there's several other factors she mentioned that said I couldn't possibly have cancer.
When we went to his oncologist, as we've been progressively seeing his oncologist, he's shocked at my dad's results. He says he doesn't believe it. And this oncologist never smiles, but every time he sees the results and he sees my dad, he smiled once. He says, I don't believe it. Basically what he said to my dad is, whatever you're doing, just keep doing it.
Well, since I started this program, I've been taking off all my medication, which is blood pressure, what was the others? Diabetes,
And
antidepressant, asthma, puffer, I have sleep apnea, it's all gone. And so now all I have is an aspirin for headache occasionally, and all my other medication is finished.
Come back in 8 weeks. That's the standard reply. You're doing well, come back in 8 weeks.
8 weeks,
Okay.
no worries. Yeah, I would say it was a miracle. It's very hard to explain. You go from just dragging yourself around to being quite active, and I noticed that I picked up very quickly after I started the program. I wasn't able to walk more than 20 paces at first, and now I could run if I wanted to.
Would you like to share with everyone your push-ups?
No.
Not on video. Okay.
we went to Paul's program in August 2004, and we've stuck with that program, and 6 months after he was diagnosed, he then got the CT scan to say that he was cancer-free. So I recommend for anybody that's thinking of the Paul Rayner program, please give it a 100% try.
I think the Rayner system is a new way of health and a new way of approaching health, not just sickness. I mean, why not help yourself before you get sick? But if you're at that stage, then it's definitely the system for you.
Well, if you want to live, get into the system and work it, and have faith, and have no fear.
Paul gives you an insight into how you can look after your body, and with his help, he guides you through your different things, your diet and so forth, so you can look after your body, and it's worked for me. I was terminally ill, and now I'm on top of the world.
With my experience with Paul and the Rayner program, I would definitely recommend it to other people suffering from cancer. And in fact, I have done that, and I would continue to do it for him. I'm sure I wouldn't be here today if I hadn't had Paul's treatment.